Hello everyone. Welcome to the practice course of pathology. Today, I will introduce to you what do we do in practice course. Practice is one of the most important parts of pathology tuition. It helps us to understand and grasp the basic theory of pathology. We do a lot of observation in practice course. There are two methods. The gross observation by naked eye and section observation by microscope. The observation of gross specimens. These specimens are obtained from surgical biopsy or autopsy. They are fixed in 10% formalin to prevent them from decaying. How to observe the gross specimens? Firstly, we need to identify the organ, and then observe the organ from the external side to internal side, from the top to the bottom, to identify whether there is any pathological change, and finally, make the pathological diagnosis. The key points of observation. Let's take this brain as an example. The first point, volume. The volume of this brain is enlarged because here the left hemisphere is larger than another one, right? Secondly, the shape of the organ. The shape of brain is slightly changed because of the increase of volume. The third, color. The color is grayish white on the surface and grayish yellow on the cut surface. Then the cut surface. We finally find the lesion here. It's on the cut surface. There is a large cyst in it, and the cyst is grayish white with some soft substance in it. Then the surface of this organ. Okay, the surface of the brain is relatively normal, right? And the capsule of organ. In some organs who has capsule, for example, the liver, the kidney. If the organ is enlarged, the capsule become tense. If the organ is shrinked, then the capsule become ruffled. The last one, the relationship between the lesion and the surrounding tissue. Here, the lesion has a very clear boundary with the. How to observe the tissue section? There are 3 steps. Firstly, observe by naked eye. Secondly, observe by low power lens. And third one, observe by high power lens. I will explain them one by one. Firstly, we observe by naked eye. Try to identify what kind of tissue it is. We can judge from color or shape of the tissue. For example, the cut surface of a vessel will be a circle in the slide, right? The second point, observe by low power lens. We need to do a fully observation. Please make sure you scan the section from top to bottom, from left side to the right side. Do not miss any corner of the slide, because pathology is different from histology. In histology class, you get a section of normal tissue. Every side of it is normal. There is no risk of missing something. But a section from abnormal tissue, we do not know where the lesion could be. So we need to fully scan the whole section in order to capture all the lesions and avoid misdiagnosis. Observe by low power lens. It's normally used in pathological observation. We need to use it to identify the tissue and identify the area of the lesion and the relationship with surrounding tissues. Number 3, observe by high power lens. It is used less normally. We use it to observe the microstructure and cellular features of the lesion. For example, we use it to observe the nucleus of a cell or observe the deposit in the cytoplasm and so on. According to the features of the lesion, we make pathological diagnosis. We combine organ name and the disease name. For example, the fatty degeneration of the liver. It's a pathological diagnosis. That's the end of this section. Goodbye.